I'm the Reverend Tom Furr. I'm the President and Executive Director of Kateri Medical Services, and I want to welcome you to our website. Kateri Medical Services has one goal, and that is to provide simple, decent, affordable medical care to the rural and urban poor in Nigeria. Nigeria is a country of about 180 million people, and in some ways it's a very prosperous country compared to other sub-Saharan African countries. However, about 50% of the population, that is to say about 90 million people, live on less than $2 a day. And those are the people we seek to help with our medical clinics. Those who are very poor and cannot afford to go to a doctor or a hospital on their own resources. So we deliberately locate our clinics in areas that are underserved to reach the poor. We began in 2003, 17 years ago, with one clinic. In 2016, we added a second clinic in Iburu. In 2018, we added two more clinics, one in Gidanwaya and one in Gusau. In 2019, we added a fifth one in Port Harcourt, which is in the south east of Nigeria. And then in 2020, this year, we added a sixth clinic in Bari Diocese, which is in Kano State in the north of Nigeria. So we now have 6 clinics, and we run these clinics year-round, 365 days a year. We raise the money to build the buildings or to renovate buildings that are already existing. We provide equipment for the buildings to run a basic clinic in each of those places. We raise the money to hire the doctors and nurses and midwives and other medical people, lab technicians and so on. So we run the year-round clinics, and then 3 of our clinics have mobile clinics attached to them wherein the doctor and nurses go from the clinic to remote rural villages to provide basic medical care in the villages. And then also, every year we conduct a 1-week free medical clinic outreach at each one of those locations. And we typically help as many people in 1 week at the free clinic as the clinic helps the entire year up till then, because we can get lots of volunteers to come and work on these things, and because it's free, they don't have to pay for their medicine or anything. We have crowds of thousands of people waiting in line to be helped. So that's what we do. In 2019, we helped 23,000 people with basic medical care through the things I've just described: the year-round clinics, the mobile clinics, and the free medical outreach missions of 1 week each at each of the 6 clinics. Now this year, 2020, we have not been able to do our outreach missions because of the COVID-19 situation. So what we've done is redirect those funds that we would have spent on medicine for each of those 6 outreach clinics, and we've given each of the clinics a grant to buy PPEs, that is personal protective equipment for all of the staff members, sanitation equipment so that they can have a place where patients and staff members can regularly wash their hands and have hand sanitizer and so on. We've also purchased food for hungry people, because in this lockdown, lots of, especially urban poor people, have no food to eat. They're starving to death. And so the churches there are providing food, so we've helped with that effort as well out of the money we would have spent on these outreach missions this summer. So this year has been a strange year for us in Nigeria, as it has been for everybody else all over the world, but we're keeping on doing what we're doing. As I said, we began with 1 clinic, we now have 6 clinics. We are in the early stages of building our 7th clinic. We had hoped to do it this year, 2020, but it looks like that's probably not going to happen because of the pandemic. However, we're making plans, and hopefully that will be done early in 2021. Our goal is to have 10 clinics built, equipped, staffed, and running by 2025. That's our goal. So, as you look at our website here, you can see the things we're doing, and we ask you to join us and give as generously as you can. And let me just say one thing in closing. 96.7% of every dollar you donate to us goes directly to build clinics, equip clinics, buy medicine, pay doctors, nurses, lab technicians, midwives, and so on. 96.7%. The other 3.3% goes to our overhead costs here in the United States for mailings and website development and so on. None of us gets paid a salary. When we travel to Nigeria, we all pay our own way. We all pay for our own accommodations. All the money, or almost all the money, 96.7% of every donation goes directly to help people in need. I don't know of any other charity that's true of. So please give as generously as you can to help bring simple, decent, affordable medical care to needy people in Nigeria. Thank you very much.